The content provided in this podcast is for informational and educational purposes only and is not intended as medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.
Is it my story, your story, his story, her story, Jane's story, Joe's story? Is it just an allegory? Show's about to start and we still don't have a name for it. Bop, 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 bop. It's a long story.
Aging and cystic fibrosis are words you don't always hear in the same sentence, but on this podcast, you'll hear them all the time, with relevant discussions and unexpected explorations wherever this podcast might take us.
So many people with CF are living longer thanks to modulators and medical advances. We thought it was time to get into some real conversations with expert guests and people from all walks of CF about what living longer with CF means, the good and the not so good.
I'm Dr. Ahmet Uluer.
And I'm Lauren Harvey.
I'm a medicine and pediatric trained pulmonologist and director of an adult CF center at a Harvard-affiliated hospital right here in Boston.
And I've had CF all my life and was recently diagnosed with CF-related diabetes. I am committed to creating a supportive space for those with CF and their loved ones.
I will bring the medical expertise and provider perspective.
I bring the real-life CF experience.
And together we bring you It's a Lung Story, a monthly podcast about aging with cystic fibrosis, where we take a little time to tell a lung story.
It's a long story.
It's a lung story. I was going to do an opera, but I have strep throat today, so that's not going to happen. So hopefully that was good enough.
Yeah, I thought that was going to be operatic. I was going to say like an aria. And you know what?
Yeah,
In homage to this episode, I would have sung it at It's a Lung Transplant Story.
I should
I
have.
think we were taking it.
But welcome everyone to our sixth podcast. And as always, I'm joined by my tireless co-host and queen of karaoke, Lauren Harvey. Hi, Lauren.
Hello. It's so good to be here, and I'm so happy always to be with our resident stand-up comedian, Ahmet.
Clearly not. And of course, our indomitable producer who is tough as nails, but thankfully really nice to the two of us, Andrea Becker. Hi, Andrea.
Hi, guys. It's really great to be here also with my the other two legs of a three-legged stool that is mostly dysfunctional, but manages to pull it together for an hour a month.
Awesome. Well, can you both believe we are on our sixth episode? I mean, this is crazy to think
I
that.
don't even know how that happened.
And it seems like we just started. And for those listening to this episode, they may think we did just start. And I just want to say last month's podcast was notable for a bit of irony with our episode on hearing loss. It was riddled by a mysterious beeping sound that our unflappable producer couldn't hear and served as a great example of the challenges of hearing loss, right?
Yes, proving that I am flappable, as it turns out.
Oh, yes. And Andrea, can you share what life-saving device you had trouble hearing?
I cannot because I do not want to get them in trouble. But I will add that so far my diabetes endocrinologist hasn't listened to all of the episodes, but she swears she's going to. And when she hears that I'm completely missing my alarms, I feel like I might get in trouble. Anyway.
Well, I mean, that beeping sound we feel is an example of sort of what makes us a genuine podcast, and we're getting better at it. Though sometimes you didn't think, I mean, I always am sort of self-deprecating, but I don't think I'm getting any better. You know, it seems like
Yes,
I can
you are.
say things. Yeah. You know, sometimes I feel like I can say things left and right before, but as soon as we hit record, I feel like I'm like negotiating my own freedom on a hostage video. But
Well,
but
I'm gonna
but
I'm gonna ask. Go ahead.
No, but I'm working on it. And today I feel like I got it. And it's mainly because I'm surrounded by amazing people. And we have a really special podcast for y'all today. And all of us at It's a Lung Story would like to dedicate this to our friend, our fellow CF community member, originally from Boston, a transplant recipient who has now courageously undergone her second transplant at Duke University, Rima Manomatis. Someone we all love and care about, and wishing her a speedy and full recovery and hurry to get back to living her life.
And
Lauren,
eating pizza.
oh,
Yeah,
yes.
she loves pizza, but I did see that she had like her first sandwich in like months the other day. So
Nice.
that's what we do it for.
That's got to be
right
the
there.
great. You guys will
Do it for the
attest to that. But
sandwiches?
Oh,
that's
yeah.
got to be the greatest feeling and the
That's
greatest
it, though.
sandwich ever.
Food in general. Yeah.
So, Lauren and Andrea, we're going to do something different today. Lauren, can you explain a little bit further?
Yeah, so before we jump in, I want to set the stage a little bit for today's conversation. There are a couple of ways we can approach a transplant episode. One can be that very medical, expert-driven, where we talk about, medical advances and how it's changed over time. And we will do that, but not in this show. So today, we're going to be talking with a different kind of expert. And by different kind of expert, I mean 3 different kinds of experts who have actually lived going through these transplants and bringing in their real stories and different experiences. And I'm super excited to hear everybody's story.
But CF is a chronic progressive disease which leads to irreversible scarring of the lung that historically led us to 2 inevitable discussions, and how to make someone feel comfortable as they face end of life, or help someone navigate the workup and preparation for lung transplant. Now, thanks to advances in treatments and more recently small molecule modulator drugs, we're facing these discussions less frequently, thankfully, but it's still the story for some. And CF can still take your average human being and force them to make a decision at a much too early time in their life to either decide to heroically face end of life, or just as heroically and willingly throw themselves onto oncoming traffic and make a decision about something that they have been dreading possibly for most of their life. And it's truly a showcase of sheer courage, resilience, and persistence for those who accept the gifts of lung from most often a perfect stranger, not the case with Andrea. We'll talk about that. And to embark on life with new non-CF lungs and a new pathway with immunosuppressive drugs. And today we are privileged to hear from those who made the decision to be transplanted, and even a second time. Andrea?
Well, for obvious reasons, or maybe not obvious, if you've been following our podcast, you probably already know that I also have had a lung transplant. My transplant was a living donor, which they don't really do anymore. And I was also the first non-related living donor transplant recipient that they had done at a very big hospital here in the Northeast, and probably one of the first in the country. And that's a whole other episode, as we like to say around here. So this episode is extremely personal to me. I've been really wanting to get to it. I've seen a lot of people on our social media who also want us to get to this episode. I feel like wanted to give the floor to these women whose stories stuck out to me for different reasons. And my story, I feel like, is just going to come out in pieces over time if you listen to this podcast. But on this show, I have been through a lot of what we're going to talk about. Not everything, because everybody's story is different. And I feel an immediate kinship with all of you. Like, I feel like we could all just be awesome if we could just go get a coffee after this and keep it going. But you all had me at, yes, I'd love to be on your show. Some of you vary by how many transplants you've had, which is just a crazy thing to say, or by the other organs that were affected and how they were affected and your other surgeries. We've all had multiple surgeries, multiple traumas that overlap and don't overlap. I'd like each of you to introduce yourselves, say a few words about your background, your diagnoses, probably more than likely, and the path that led you to your transplant or transplants, and where you are today. So we're just going to start with Beth. And Beth, when you're done, just pass it off to Kayla.
Awesome.
Not Kaylee and not Caleigh. Kayla.
I'll be sure to get it right. Hi, I'm Beth Peters. I'm 44 years old. I was born in 1980 with CF. I was diagnosed pretty early because I had an older sister who has since passed away, but she was diagnosed at the age of 3. So I was diagnosed at 6 months. I had a pretty healthy childhood, with the exception of some nutrition issues and being very underweight. But my lung health was pretty stable in my childhood, and I only had a few hospitalizations. My health struggles really keyed up in college and in my 20s. And I had a pretty drastic decline of my lung function in my 20s as I started my career. And then I moved to Boston for graduate school. And by the time I was 29, I was needing to decide whether to get a lung transplant or not, because I was definitely in end-stage lung disease. So I did elect to have a transplant by the age of 30. And so that was almost 15 years ago now. And now I am on the transplant list for pancreas and kidney from a disease process following that lung transplant. So that's the beginning of my story.
Great. And so, Kayla, you're next.
Yeah, first off, I just want to thank you guys, Andrea and Ahmed and Lauren, for inviting me onto It's a Long Story and having me here. Yes, we all are connected in such an amazing way. I was diagnosed with cystic fibrosis at birth and spent my childhood and teenage years as healthy and social as possible, playing multiple sports and staying active in charity leagues. But as I entered young adulthood, my disease progressed and I began managing the daily realities of cystic fibrosis, frequent hospitalizations from infection, CF related diabetes, and digestive issues. After my lung function declined significantly, I underwent not one, but 2 double lung transplants, both times initially being denied and placed on hospice after being labeled too ill, air quoting, to survive. Today, I'm nearly 10 years post my first double lung transplant and 7 years post my second. I focus on living life fully, advocating for others with chronic illness, while sharing my own journey on social media at Fight to Breathe, publicly speaking to peers and medical professionals, hosting a podcast called Our Fight to Breathe, and soaking up every moment I can by traveling, being creative, and spending time with my dogs and husband. So that's a little bit about me, and I can't wait to share more. Should I pass it off?
Thanks, Kayla. I've been following her on her Fight to Breathe social medias for years now. So it's been fun to connect in more ways than one. But my name is Tara, and I was diagnosed with CF at 14 months old. I was lucky to grow up relatively healthy having CF. I just took my meds. My parents kind of just adapted it into our day-to-day life of, this is what you do. You wake up, you do your meds, you do your treatments, and off to school you go. It wasn't until I was 17 that my lung function kind of started to deteriorate out of nowhere. No medication was working. We tried hospitalization and we just couldn't get my lung function up. And basically within a year of being told that we weren't sure why my lungs were kind of deteriorating, I ended up having a double lung transplant. So I went from being told I was healthiest in the clinic, turning 18, moving over to adult clinic, and finding out I was the sickest in the clinic. So that was a whirlwind of a year. It's now been 13 years, almost 13 and a half years since that transplant. Things went really well initially, and unfortunately, I rejected those lungs just 2 months shy of the 2-year post mark, which was kind of you're all clear, you're ready to move on, you're not monitored as closely anymore. So I say I'm lucky, but not quite all the way there. I was able to stabilize with those lungs for another 4 years. So I had them for a total of 6 years before I listed again and received my second double lung transplant. What was kind of unique about the two is the first time I waited 11 days on the transplant list was called lungs for you, ready to go. We were not prepared. The second time around, I waited 2 years and 2 months. So I kind of went from one extreme to another. But it's now been coming up on 7 years with this second set of lungs. And they are very happy, doing very well. I have become diabetic with all the medications and CF-related diabetes. And most recently, I've been fighting hairy cell leukemia as a post-transplant complication. But overall, my quality of life is still way better than it was with my CF lungs and just spending hours on hours doing meds and sleeping and treatment, and basically not living. So I am excited to be on this lung story with everybody today.
So many great
Thank
stories.
you,
Thank you.
Tara. I should also point out you're our first international guest. hailing from Canada, Toronto to be exact.
Up
So,
north.
but
But we have
thank
two
you.
people that are global.
Kayla is in Spain, but you're not
Right?
from Spain, right?
No, pero
But
soy española ahora.
yeah, like, but I would say
Oh,
that we've
lo
got
Ay, ay,
siento.
ay.
yeah, caliente.
Thank you so much for introducing yourselves. You saved me a lot of work and breath. And we are now going to move on to some questions. So Lauren is going to take you from here into the world of questions.
Yeah, so I'm going to start with Tara. And, you've had 2 lung transplants, which is already a huge thing. But on top of that, you also mentioned that you have recently faced the cancer diagnosis. And for all you people out there, we will be recording a separate episode focused on cancer and those risks, but we're not going to necessarily focus on that today. But for this conversation, I want to acknowledge that being immunocompromised after transplant comes with a much higher risk of cancer, and hearing the word cancer after going through all of that, I could never imagine. And so, Tara, what went through your mind in that moment? How did you process that? And how are you doing now?
To keep things PG, there were some words that came out, but my overall reaction was, "You've got to be kidding me." It was like having gone through both transplants and just everyday life with CF to then find out on a fluke, actually, that I had this type of blood cancer was to hear that big C word is almost scarier in my mind than transplant, because anything lungs, like, I'm used to. That's my norm. I can handle that. But this was something kind of out of my normal realm. So it was definitely a moment of freaking out. I reached out to some other CF patients that I know of from the States who had also been given cancer diagnosis lately. The chemo brain is a thing. But basically, everyone was super supportive and was like, "Don't freak out till you know what you're dealing with." But I freaked out 100%. This was back in September of 2024 now. I had gone to my CF clinic in June, and basically it was a social visit. I was having no issues. I had nothing to say. And I happened to mention that it felt like I wasn't digesting my meals as quickly, like I was feeling really full afterwards. So they said, "Well, why don't we do a stomach ultrasound? Just make sure nothing's happening. This could just be you getting old with CF because you're in your 30s now." And believe me, I feel like I'm 80 some days, so that I can relate to. I had that stomach ultrasound done, and it came back that I had gallstones, an enlarged liver, and an enlarged spleen. So I kind of panicked thinking, "Oh no, gallstones, I'm going to have my gallbladder out. Like, this is not great. I got to tell work I'm going to be off, and I'm worrying about this." And then I got a referral to a blood doctor. A hematologist was a new one for me. And I was kind of confused. And I'm like, "Oh, maybe he handles gallbladders." So I went to Toronto, and which is just over 3.5 hours from my hometown of Sarnia. And I'm in this meeting with him, and he's talking, and he's like, "Very nice to meet you. I've reviewed your history. And with being post-transplant, I'm sure you've heard of post-transplant lymphoma disorder, or cancers that are related to being post-transplant. So we're leaning towards this being a blood cancer." And I kind of had to stop him and be like, "You're not taking my gallbladder out today? Like, what is happening?" So it all kind of, snowballed from there. I had a bone marrow biopsy done, and with the results of that coming back, it confirmed that with the enlarged spleen combined with low hemoglobin levels and low white cell and red cell counts, that I had this hairy cell leukemia as part of this post-transplant lymphoma, which is essentially just saying because of all the immune suppressant meds you're on, you're more likely to develop cancer. So my main transplant doctor called me after the results came in. We have an ongoing joke that, I make her earn her money because it's always something with me. And she calls, she goes, "You've got to be kidding me." She's like, "We had to pull out the research books and the textbooks and reach out globally. And you are the 4th patient on record to have this type of post-transplant lymphoma." And I was like, "Hey, well, if you put my name in the next textbook, I want royalties from this." So it was kind of scary knowing that there weren't many other patients out there with this specific type of post-transplant cancer. but it is known to be a well treatable cancer if found early. And because we found it on a fluke with the stomach ultrasound and not because of other symptoms, we caught it very early. So I had minor symptoms from it, just some stomach discomfort and fatigue, which I just attributed to my crazy life. I don't sit still well, because when you wait for lungs for half your life, when you're healthy, you want to go, 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 which I'm sure everybody can relate to. So in December, we got the official diagnosis, and I was told that we would proceed with some chemotherapy, and there was no immediate rush for it, which did not make sense to me. I'm like, cancer, let's get this. Like, I'm used to, if you're CF and you have an infection flare up, it's like, hey, pick line, next day, IV, let's go. And they were like, because we cut it early, we have time to figure out the best med treatment for you and everything. So you can go home, enjoy your Christmas. And, so I'm at home going, okay, do I tell people I have cancer? Merry Christmas. I have to go in chemo. Like, how do I, because it was something that was setting off all the alarm bells in my head of, I have cancer now. But also being told, it wasn't anything too extreme and we've caught it early. So the other factor in all of this was I'd been doing fertility testing the last 2 years with my husband just to see what our situation was, because after transplant, you're told most of the meds you're on can destroy your eggs. So on like a whim, I just went to the local fertility clinic and did all the testing, and they're like, you have absolutely no fertility issues. You have a boatload of eggs. You're good to go. My husband had gone with me, and they offered to do just a blood panel test on him for editing. And they're like, we don't have to if he's already been tested for CF, which he had like 14 years ago. And I was like, oh, he can handle one needle poke if I have to go through all these tests. So how matter? So 2 years ago, we found out he actually is a CF carrier. I was kind of excited because I was like, holy, research has come so far in 14 years that there's new mutations that they're able to pick up. But I also was like, you've got to be kidding me, because we were cleared to go ahead with a normal pregnancy, and now we're dealing with CF. So we were kind of had put a hard stop to any parent plans at that point. So with the cancer diagnosis, we were actually able to kind of expedite an egg retrieval for myself, because at that point it was the chemo would likely destroy all of my eggs. Fortunately, in Ontario, there is an insurance government policy that covers the egg retrieval if you are in a situation that you're doing so because you're in an end-of-life situation, you're undergoing chemo, that kind of thing. So in January of this year, I was able to do all of the hormone shots and be a raging hormonal human and have an egg retrieval before I started my chemo treatment, which was a success. Chemo, we did 5 days back to back, and I was very fortunate that I had very minor symptoms from that. It was mainly just fatigue and some muscle aches. I've been having more issues like 2 and 3 months out of the chemo brain and the chemo fatigue, which they warned me of, but I thought since I had no symptoms, I was going to be fine. So at this point, I have been told that I'm pretty much in the clear with just 1 round of chemo there. I did have to go to Toronto for a month for a lot of observation, blood work, that kind of thing. But we are waiting until July for the kind of official you're in the clear test, because they have to give the chemo time to work in your body. So just my day-to-day right now is managing my fatigue and working back up to a functioning brain and being back in the office at work, and just not pushing myself too much, but also, not sitting at home doing nothing. So between my nannying job and my niece that will be a year old tomorrow, which I'm so sad but excited for, I've been spending my time with my dogs, my cat, and the babies. And then who wants to go back to work when you can just do that instead? But just trying to keep my brain working and enjoy day to day.
It's and thank you so much for sharing that. I was going to say, and I think you meant this in the beginning, but like people with CF are used to, just waiting for the other shoe to drop often. And
Yeah.
but, like cancer was really, through you. And I just want to say,
If there was like a smack in the face with a shoe, it wouldn't have fallen off.
And I know there was an F in front of that other statement where you said, you got to be kidding me.
Yes.
But the increased risk, and, compared to the general population increased risk, sometimes at 15-20% more in people who've received a lung transplant. So, not something that you obviously need to actively worry about, but like just to do the screening. And those are things we're going to talk about at future podcasts. But thank you for sharing that and just the incredible journey, with your cancer diagnosis.
Yeah, thanks. It's multifaceted for sure.
So the next question I want to ask to Beth, and Beth, I recall it was a difficult decision for you to be listed for transplant, let alone the decision for even just being worked up for transplant. And I know there are many people who are sitting in a similar spot as you were 15 years ago. And I think you said it was about 15 years ago. And I remember that. What do you say to that person who's listening, who is either contemplating transplant or perhaps they're on the transplant list and thinking about, what you've sort of shared with me back in the day about just waiting for that phone to ring? What do you say to them and to your younger self, maybe, that you want to share about waiting for transplant, what it was like, and what do you want to share with that younger self or that person who's listening right now about transplant?
At the time that I was faced with the reality of needing a transplant, my sister had already undergone a transplant and had a pretty rough time of recovery, and she's since passed away. And so I was dealing with the trauma of that and within the family structure and kind of the disappointment of her not really getting back to the life that she thought that she would. And I also had been through a lot of medical trauma in the 10 years that follow, that came before needing to make that decision. And I think that's very common among our population, that either they have a long period of a lot of medical intervention followed, or they have an acute period of a really intense amount of medical trauma and intervention that leads them to finally having to come to this choice, because transplants are to save your life. So that means if you don't get your transplant, you're not going to live. So for me, I didn't know how to navigate signing up for more medical trauma or for more medical intervention. But now that I've lived through it all and I came out the other side, and it's so many years later, many more years than I thought at the time that I was transplanted, to be 15 years out now to me is insane. I would encourage people to be brave and go through the workup and go for it, because things have changed so much, and the way they do the matches of transplant have changed, the way that people are matched to their organs, the treating rejection and infection has changed so much and come so far. I would really encourage people to go for it. I was also thinking, Ahmet, about a dear friend of ours who passed away named Brian Circus, and he put off the decision to have a transplant and didn't want a transplant and didn't want a transplant. And then by the time he wanted one, there perhaps wasn't enough time to make that happen. And then he passed away. And I always think about that. I always think, if there's even a little bit of you that wants to move forward, you probably should, because if you wait and you wait and you wait, you might change your mind too late. So I thought a lot about that. And then my other thing I would tell myself, which I did an okay job about this, but I could have done a better job, is that after you make the decision to be listed for transplant, your job becomes to get in as good a shape as you possibly can, even though your lungs are failing. Because the better shape you're in, it will help you recover so much faster and so much easier. So you have to still maintain this idea that you really have to keep your health 120%, and you can't give in to some of the negative feelings and all of these things that happen when you're on all of the meds and your lungs are failing and there's so many limitations on your physical ability. You still have to work hard to get into whatever kind of healthy shape that you can get into before that day comes that you get a call.
Beth, thank you so much. I was going to say median age of survival is what we talk about. And for people who get lung transplant for any reason, people with CF actually have the best outcomes. And, the median age is I think over 9, but, certainly as things get better, and as you said, the surveillance, the way we're doing matching and even preserving lungs to be transplanted has really improved outcomes. And thank you for sharing that. I know just how living through those moments with you, and for those who are listening, I've known Beth for a long time now. You're the the vision of courage to me, the way you handled it.
Thank you.
I also lost a sibling, Beth, prior. I'm not sure what the order was when your sister passed and when you decided to move forward, but my brother passed away 7 years before my transplant. I would encourage people to keep reminding yourself that the story of even somebody very dear to you is not necessarily going to be your story. And to not get hooked into that, because it's very easy, I think, to think, well, I lost my brother to a transplant. Like, this is, what's going to happen. You've gone through, grieving, and in my case, a funeral, and years of honoring him as, a fallen transplant soldier. And then you can't help but think, well, I'm going to be next, So I had to do a lot of work to get to a place where I was like, this is my story, and I don't know how it's going to end, but you have to like really do a lot of work to say, um, you know, if I do my, my little exercises, my little crappy lungs, um, and do what I think I need to do to prepare, then it's going to be my story.
Listening to Beth and Andrea share their experience with losing a sibling is very real in the community. And I think that people with cystic fibrosis, I know myself, I'll just speak for myself, I've dealt with a lot of survivor's guilt in my life surrounding my friends who have lost their lives with cystic fibrosis, and wondering why maybe I'm gonna have the chance to have a transplant while maybe somebody else hasn't. And then also, I've also dealt with a lot of survivor's guilt surrounding my donor. When I was waiting for my first double lung transplant, that was something that I don't think one day went by without me thinking about, was that I was hoping that I could live while somebody else, possibly unknowingly, was having the last days of their lives and the last moments with their loved ones. And the only reason I wanted to live was to share the moments with my loved ones and be at those weddings and be at my, the birth of my friends' kids and share those special times with them. And what ate at me at night a lot was that sense of feeling like I'm hoping that my phone's gonna ring for my transplant, knowing that somebody's, gonna go through extreme tragic loss at that same time. And so while you were saying, that each of our stories is so unique, I do want to emphasize that as well, that just because somebody else loses their life doesn't mean that you're going to. And that, like you said, if there's a little bit of hope or a little bit of motivation behind wanting to live another day, to definitely at least get evaluated and get listed. But you also have to be willing to do the work post-transplant. You have to be willing to be compliant to your regimen and take care of yourself, because the worst thing you can do is take the organ of somebody that maybe would have done that if you're not willing to as well. So there's a lot of, I guess, points that I ended up rambling on about, but everyone out here listening, I'm sure, has dealt with loss in the CF community, and my heart goes out to everybody.
But you bring up a really great point, and Kayla, thank you so much for sharing that. But it does take a lot of work. You can't just get lungs and expect everything is going to work out great. You have to work hard. You have to be dedicated, as Kayla just said. So, and that is part of the secret to that great, longevity, is because all of you, have really put in that work and had that fight.
Yeah, my center kind of always summed it up as you're trading one disease for another, which sounds really depressing initially, but it makes sense once you're in it that, yeah, I'm not doing my CF inhaled meds anymore, but you're now on like a full-time job of, like you say, following your medical regimen and all that. And like, just to kind of echo what Caleigh said, and everyone, I could not imagine losing a sibling to CF and having done, and I didn't know that about Beth and Andrea, but I know how hard it hits me just when someone in the community passes and they're in a similar situation, or you kind of limit yourself from making too many CF friends, I find. And that's when I think like I'm lucky that I was so naive and went from extreme health to sick to only 11 days on the list waiting for lungs the first time, because I didn't have the time, honestly, to even open the book about transplant. Like I went in assuming I was going to be cut vertically, and I got horizontally clamshell cut. Like, as I'm showing people, you can't see me, horizontal and vertical. I think like that worked in my benefit being so young at 18. And same thing, like Caleigh said, just wanting to, make it to my graduation, make it to a wedding, my friends' weddings, families, babies, births. Like the little things really are the big things. And that's what can motivate you on like those tough days. But it definitely, there's a lot of loss that comes through this community, but it just kind of makes us, I don't say stronger, I say tougher, because we're all strong to begin with. You don't have to go through loss to be strong, but it's a tight-knit community and everyone truly is unique.
I'm slowly learning the process, and, I've been learning that transplant centers don't necessarily follow the same guidelines for listing someone for transplant. So it means you can be listed at multiple centers. This question will be aimed towards Caleigh. You face such a challenge among, others in getting listed. Please tell us, about visiting these multiple transplant centers while figuring out where to go when so much was on the line, and while you were doing it all while you were sick, which is crazy to me. How did you make that decision twice? And what helped you feel confident in the team or place that you chose?
That's a loaded question. As Tara said, chemo brain, there is absolutely such thing as immunosuppressive brain as well, and tacro brain. So I'll try to answer everything. But to share a little bit, I was told I needed my first double lung transplant at 21 years old, and I waited 18 months for my first transplant. My second transplant, I waited about 6 months inpatient the entire time while I was listed. So my first transplant, I was evaluated and listed at my main center where I was being seen from the age of 19 just until that point. So it wasn't too long, but of course, those doctors knew me. They knew my case really well. They had been treating me for a long time. And we did have a really strong relationship in some ways. And also, at some points, I feel like a tough relationship as well. And so, as you mentioned, each center is different. And I think that's really important to remember, because as I've matured in my medical journey, I've learned that I do have the control in my health journey because I am the one who cares about it most, and it is my life. And I have to think about it that way. I think, it's like friends in business. It's like sometimes you have to think business and you can't just think about, emotions that are tied within certain people. But I was listed at my main center and I waited there for 18 months. And during that wait, I progressively got more ill, as we all do. But I did have a normal CF decline, meaning years and years of decline and no particular traumas. I was mostly living in the hospital more days than at home. And during that time, my transplant team approached me and said, "We think it's time that you double list." And I was like, "What's that? And why haven't I heard of it before?" I've already been waiting over a year and we're now considering this. It felt like, to me, I'm not the medical professional, but to me, I was like, wow, I've never even been given this option before. I've never heard of anybody else doing this. But it was a great opportunity for me because I was really small. I am 4'10". I'm now 4'11" due to posture gain. Hey, and breathing right. But I was 4'10". I was about 65 pounds. I was on oxygen full time. I was on a feeding tube full time, 24 hours a day. And when I was given this opportunity, I asked a lot of questions. And mainly it was just, what advantages is this going to give me? And what disadvantages might this have? There really weren't any disadvantages. My team did all of the work for me. They used, every all of the tests from evaluation and forwarded it to that second center because I was really ill and traveling wasn't going to be an option for me that would be like easily done in case something happened on the road or whatever. I couldn't fly in a plane because I didn't have, the lung capacity. So they forwarded all of those tests, and I ended up getting double listed, as they say, at a center in the same state but a different region. And the advancement or the advantages of that really is that UNOS, the United Network of Organ Sharing, is who matches lungs. And so when you're waiting on a transplant list, they do all of these evaluations, including blood type and tissue type and all of these things. And they put it into a database. And when a donor becomes available, you are then matched. So the United Network of Organ Sharing matches people based on all of these requirements like blood type, tissue type, and so on. And when you're matched, it basically is done within a region because for lungs, they're only kept viable for so long. So I believe I was told at that time it's like 4 to 6 hours, and they're kept viable in different ways, but you need to be able to get to the center or bring the organs to you. So you really can't be across the country because, it's going to take too long for the surgery, for the travel time. The risks are really high. And so this is why it is important to be an organ donor, because the more organ donors we have, the more organs are available for people within your same region. And I'm sure there's advancements now because I do see on social media that organs are flown many, many, many more hours. They're kept in a machine, which during my second transplant, they were kept in the machine that like pumps oxygen into the lungs. And so it can stay for a lot longer. I don't know the technical term for that. But yeah, it really helped me because it allowed me to possibly be matched to a lot more individuals and organs. But I was matched after 18 months to my first center, my main center, and the recovery was pretty smooth. But I did have a medical trauma about 8 months later, and the medical trauma included me aspirating from digestive issues, which sent me into extreme respiratory and heart failure. So I was put on an ECMO machine, which is basically like bypass for the heart and lungs. It keeps your main organs functioning so that your body can rest and try to recover from whatever infections or complications you may be having. And I was kept in a medical coma during that time for several weeks. And when I woke up, there was a lot of irreversible damage to my lungs. So there was a lot of scarring that had taken place. There was a lot of things where I was not going to gain my same lung function, but that didn't mean that I wasn't going to have a life where I could thrive in it. It just meant that I wasn't going to reach the point after my second transplant that I initially had hope. I had always been really athletic, so I was sort of hoping I could be that gym rat again and do, marathons and all that stuff that I wanted to do and hope for. But I really just kept an open mind. And after that, though, I was in the hospital for months for the recovery. I learned to re-walk, re-swallow, re-talk, just everything. Basically, I was like a newborn baby. My memory was gone. I had to learn who people were again. It was really, really traumatic, and I still definitely suffer from extreme PTSD from that. But I started having frequent infections again. I never really could stay out of the hospital. I was still hospitalized more often than I was home. And I ended up getting pneumonia, and that sent me into a really downward spiral. I declined at such a rapid rate that it was pretty obvious what was happening to me. And so my doctors had said that they should do a bronchoscopy to see how my lungs were truly doing, do a lavage, and try to see if they could maybe even clear anything that was in there that was like an infection that they could see and point out and test. So we did that, and I showed up with A1 rejection, and it was treated with steroids with just, I think, 3 days of infusions. And I was sent home and basically told I didn't have rejection anymore. But my lung function kept declining. And when I say declining, I don't mean I'm going weekly to clinic and it's like 1%, 2%, 3%. It was 5-10%. So I was going from being independent, maybe not at the best lung function possible, but certainly at the same lung function I have today, but doing a lot less, to all of a sudden needing 8-10 liters of oxygen at home, being hospitalized for high flow just because I couldn't do anything. I couldn't walk. I couldn't eat by mouth. I mean, it was a true struggle. I was scared to go to sleep at night. It was emotionally and physically very draining. And at that point, I knew that I needed a second double lung transplant, and my center told me that they needed, to work me up to a second double lung transplant, but I was too sick, and I was declining at such a rapid rate. And so they hospitalized me as what they called a Hail Mary to try to find any sort of anything that was a pointer to what was happening and why the decline was so fast. They truly said like they hadn't seen something like that often at all. And so after this workup, they declined me from a redo transplant just due to them not having the confidence in my survival, which I now, looking with a bigger perspective on like the overall picture of it, truly do understand, because I understand as doctors, they're making the best choices for not just me, but multiples of patients. And they have to consider everybody in, their program and other programs, and the organs that, the organs go to somebody who can survive. And they weren't confident in that. And so I took matters into my own hands along with my support network. And we requested all of our medical records. My husband is a logistics professional person. So he put it into a database, and we started reaching out to hospitals around the country. The only holdup was that I actually had state insurance. So at that point, I couldn't really go anywhere else besides, I think, 2 hospitals other than the one I was at. And so it was really tough. But I was already engaged, and we decided to have a ceremony and get married, which I questioned because I didn't want to widow somebody at 23, 24 years old. But he was very insistent, and he's an amazing guy. And he's like, anybody in the next phase of my life will have to understand this part of it. And so we got married, and that allowed me to expand my network of hospitals as well. That's not the reason we got married, but it was very helpful. And we started making cold calls to everybody we could at the hospital. We were literally reaching for marbles, trying to ask for favors from anybody. And I started sending videos of myself to centers to try to show them my personality and my will to live, and that I was very motivated and driven to live. And that, I think, was a big component of me going to a center, because on paper, I basically looked like I was 2 seconds from death's door. And I was not willing to take no for an answer. And a lesson that I learned is just that, every center is unique. Some centers may say yes, some might say no, but you just have to keep looking and be persistent and advocate for yourself, and really believe in your goal. And so I got listed at a second center. And at the end of the day, I chose that center because 1, they were willing to take a chance on me, and 2, they really made me feel comfortable and confident in that decision.
I have so much I want to say right now. Hey guys, that's it for part 1 of CF Transplant Stories, 3 Women's Voices. As usual, we had so much to talk about, we just didn't want to stop. So we didn't. If you want to keep hanging out with us, the conversation continues in an early release of part 2 over on our YouTube channel. Yes, we have one. And if you've only been listening to us on audio, it's a great chance to put some faces with some voices. It will be dropping on the week of July 7th. You'll hear stories and reflections that didn't make it into the first segment. The group talks about what it takes to get listed, find a center that will say yes, and stay alive through red tape, denials, and decisions no one trains you for. From fertility, IVF, body image, and relationships to careers and community, this app is about the messy, ongoing work of finding your way forward. It's honest, it's real, it's funny, and it's very us. Again, you'll find the early release of part 2 exclusively on our YouTube channel. We'll drop the link in the show notes. While you're there, give us a like, leave a comment, and subscribe if you haven't already. We'd really appreciate the love. It helps us grow. The episode will drop on all podcast platforms the following week. We are working hard to provide meaningful information to a deserving CF community, information you won't find anywhere else. If you'd like to help us grow, we'd greatly appreciate it if you would follow us on Apple Podcasts, Spotify, or wherever you get your podcasts, so you never miss an episode. Want to go all in? Leave us a rating and a review. It helps people find us and makes a big difference. If you found this episode helpful, please share it with a friend, family member, caregiver, or provider who might also want to hear it. This helps you, it helps them, and it helps us spread the word to those who need to hear it most. It's a Long Story is produced by me, Andrea Gavin Becker, and is hosted by Dr. Ahmet Uluer and Lauren Harvey. Additional editing and production support is provided by the team at Resonate Recordings. Until next time,
Get a little older.
Live a little bolder.